Dr. Nardi here, back with another video. Today, we are exploring one of the most fascinating and chilling topics in all of criminal psychology, psychopathy. Chapter 7 delves into a specific type of offender who displays distinct emotional, cognitive, and behavioral patterns that set them apart. We'll examine what a psychopath is, how we measure this trait, and whether there's any hope for treatment. Psychopathy is arguably the most studied construct in our field. It's important to understand from the start that it's not a simple yes or no category. Instead, psychopathy exists on a continuum, meaning individuals can show these traits to varying degrees. So, what exactly is a psychopath? The term is often confused with others. A sociopath, for example, is really a non-clinical label for someone who persistently breaks the law. We also need to distinguish it from a formal psychiatric diagnosis. This brings us to antisocial personality disorder, or APD. While some people use APD and psychopathy interchangeably, they are distinct. APD is a clinical diagnosis from the DSM-5 characterized by a pervasive pattern of disregard for and violation of the rights of others, and it always involves criminal behavior. Psychopathy is a personality construct that is broader and focuses more on emotional and interpersonal traits. You can be a psychopath without an official APD diagnosis, and not everyone with APD meets the criteria for psychopathy. The modern understanding of psychopathy is built on the work of Hervey Cleckley and was later refined by Robert Hare. The behavioral characteristics are paradoxical. On the surface, psychopaths often have a superficial charm and average to above average intelligence. They can appear friendly, outgoing, and likable, but underneath this mask is a cunning and manipulative personality. This is where we see the true core of the disorder. Psychopaths are defined by pathological egocentricity, a profound selfishness, and an inability to truly love or connect with others. They have a complete lack of remorse or guilt for their actions. They may say they're sorry, but the words are hollow. This is called semantic aphasia. They know the words, but not the music of emotion. This is accompanied by shallow emotions and an incredible callousness or lack of empathy. They also have a deep pathological need for stimulation, drawing them to high-risk and thrilling activities. While only about 1% of the general population are psychopaths, their numbers are much larger among convicted criminals. And when they do commit crimes, they are often the most violent and persistent offenders. Their violence is frequently cold-blooded, callous, and directed at strangers. So how do we measure this? The most widely used instrument is the Psychopathy Checklist Revised, or PCLR, developed by Robert Hare. It's a 20-item scale that assesses the key traits across different facets of a person's life, using interviews, observations, and official records. However, it's not without criticism. Some argue the PCLR is overused, and because it includes many questions about criminal acts, it may fail to identify psychopaths who manage to operate within the law. Our understanding of psychopathy has evolved. We used to view it as having two main factors: the interpersonal affective side and the antisocial lifestyle side. But contemporary research now suggests a four-factor model is more accurate. This includes the interpersonal factor, like lying and manipulation, the lifestyle factor, like impulsivity and sensation-seeking, the affective factor, which is the callousness and lack of empathy, and the antisocial factor, which is the poor self-regulation and persistent criminal behavior. This leads us to a critical question. What is happening in the brain of a psychopath? Let's look at the neurobiological factors. Research has identified key differences in brain structure and function. We see evidence of hemisphere asymmetry, which might explain why psychopaths can talk about emotion but can't use it to guide their behavior. There are also clear links to deficits in the frontal lobe, the brain's executive control center, which impairs planning and impulse control. And perhaps most importantly, we see dysfunction in the amygdala, the brain's emotion processing center, which helps explain their fearlessness and poor emotional processing. This dysfunction extends to the nervous system. Psychophysiological research shows that psychopaths have a chronically under-aroused autonomic nervous system. We can measure this with skin conductance tests. When faced with stress or fear, most people's hands sweat, but psychopaths remain cool and calm. This under-arousal means they are deficient in avoidance learning. They don't learn from the painful consequences of their actions in the same way others do. Can we see psychopathy in children? There's considerable debate about this, but researchers focus on what are called callous unemotional traits, or CU traits. These are the childhood markers of psychopathy. However, labeling a child a psychopath is ethically fraught, as many adolescent traits can mimic psychopathy. Research does show a link between these traits and early risk factors like physical neglect, poor parenting, and family disruption. This brings us to treatment, and for adult psychopaths, the outlook has been discouraging. They are highly resistant to treatment, often manipulating therapists and learning to use therapeutic language to become even better criminals. Research indicates that traditional treatment is largely ineffective for this population. However, there is reason for optimism when it comes to youth. For children and adolescents with callous, unemotional traits, sophisticated and intensive treatment programs can be effective. Successful interventions are often cognitive behavioral. They focus on building self-regulation skills, and they heavily involve the family, particularly through programs like multi-systemic therapy, MST, and functional family therapy, FFT. The key is early and intensive intervention. To summarize, psychopathy is a unique and serious personality construct characterized by a profound lack of empathy and remorse, with deep roots in neurobiology. While it remains one of the most difficult disorders to treat in adults, there is emerging hope that with early, intensive, and family-focused interventions, we can help change the developmental trajectory for high-risk youth. Thank you for watching, and I'll see you in the next video.